Blood infections in burn patients. Burns are a type of trauma which can be caused by hot water, electrical currents, but most commonly by fires. Any severe burns usually require a visit to A&E. Whilst in hospital, there is a small chance of developing an infection caused by viruses, fungi, or most commonly bacteria. This leads to worse outcomes in those patients, so they are in hospital for longer. Normally, the infection would be local to a tissue, such as a bacteria that has entered your lungs. There will be a type of white blood cell in the lungs which will eat up the bacteria. While the white blood cell eats the bacteria, it will release some chemical signals. These will tell the cells that line the blood vessels that there is a bacterial infection in this tissue. This will cause the cells that line the blood vessels to display proteins on their surface. Normally, a white blood cell called a neutrophil circulates in your blood. When these proteins are expressed and there are chemical signals, the neutrophils can smell them and move towards them. The neutrophils will stick to the proteins on the blood vessel surface, and as they get stuck, they can squeeze into the tissue. Now that they have been guided to the bacteria, the neutrophils will eat the bacteria in the tissue to stop the bacteria from causing damage. These neutrophils will also release their own chemicals, attracting more white blood cells to kill the bacteria. However, this infection can trigger sepsis. Sepsis is when the local infection becomes widespread. The bacteria can escape into the bloodstream from the lungs. This causes an excessive release of chemicals, which leads to inflammation throughout the whole body instead. The blood vessels are like pipes. These clean pipes now have sewage in them, making them dirty. So the body tries to clean the mess up, but this gets out of control in sepsis. This sepsis can cause smaller blood vessels to begin leaking into the tissues around them from the damage caused by the bacteria. But more alarmingly, sepsis can lead to multiple organ failure, as the patient's blood pressure drops in sepsis. This means the blood cannot flow as quickly to vital organs like the brain, kidney and heart. The lack of blood flow is made even worse as sepsis can cause the formation of blood clots. They block the flow of blood in the vessels, making it even harder for the organs to receive oxygen from the blood. It is estimated 44,000 people die of sepsis in the UK each year. This is why early diagnosis and treatment with antibiotics to get rid of the bacteria, as well as intravenous fluids or medications like vasopressors to raise blood pressure, are crucial. As the presence of sepsis is high in patients after burn injuries, research is being done into finding biomarkers. Biomarkers are indicators of a condition. In the first study, Dr. John and his team tried to find a combination of biomarkers to reliably diagnose sepsis and detect it as soon as possible, as single biomarkers are not as effective. If biomarkers are found, we can both prevent the development of sepsis as well as treat it early. Research was done on a group of burn patients with sepsis compared to burn patients without sepsis to look at differences. Some of the biomarkers of sepsis found were changes in neutrophil function. Normally, there are 3 key roles of neutrophils. They can eat up bacteria known as phagocytosis. They can make molecules known as reactive oxygen species which kill bacteria. They can also make web-like traps by releasing their DNA to capture the bacteria and stop it spreading, known as neutrophil extracellular traps. After trapping them, there are chemicals present to kill the captured bacteria. In the group of patients with sepsis, it was found that neutrophil function was reduced more than those without sepsis. This is because the sepsis patients have a high number of immature neutrophils. Neutrophils come from the bone marrow, and in these patients, they leave the bone marrow too early, which affects their functionality. Another biomarker they studied were platelets. Platelets are little bits of red blood cells. They are needed to clot blood to stop bleeding and allow healing. In the group of patients that developed sepsis, it was found that the number of platelets was lower than those without sepsis. This is due to a decreased production of platelets in sepsis, as well as platelets being used up in the blood clots that were blocking up the vessels earlier. These findings show the potential use of a combination of biomarkers for the early prediction and/or diagnosis of sepsis in these patients. In a newer study, another group of burn patients were looked at, but this time the patients had at least 15% of their body burned. Some more severe burn cases were being targeted. The larger the burn, the more likely you are to develop sepsis. Research was done on a group of burn victims with sepsis compared to healthy people to look at the differences. In this second piece of research, the predictive biomarker found was cell-free DNA. Normally, DNA is found inside cells and contains genetic information. However, when cells die, they release this genetic material, as well as when neutrophils make their extracellular traps. It was shown that the burn patients with higher than normal cell-free DNA went on to develop sepsis. Normally, cell-free DNA is removed by an enzyme called DNase. Burn patients compared to normal people had less DNase, so more cell-free DNA. The high cell-free DNA contributes to the risk of organ failure caused by sepsis, and so the dropped levels of DNase in burn patients makes them more likely to develop sepsis. The drop in the DNase is due to the damage that happens to the patient's tissues when burnt. The damaged tissue releases a protein called actin. The actin can be released as a single molecule or build up into a chain. These actin molecules lead to a drop in DNase activity, so reduce the ability to remove the cell-free DNA. Two proteins normally bind onto the end of the single or chain actin molecules to control them. But after the burn injury, these proteins are decreased. The reduction of these proteins that control the actin occurs before the sepsis and multiple organ failure develops. So these proteins can indicate the development of sepsis and are good at telling us if patients will get sepsis or not. This current research has shown that we need to find ways to increase these proteins so that actin can decrease. The drop in actin will allow an increase in the DNase enzyme, allowing removal of the cell-free DNA. By looking out for these changes in the blood of patients, we can spot sepsis early and confirm it. Pairing neutrophil function and platelet numbers also showed potential for early diagnosis of sepsis in patients. So improving neutrophil function as well as raising the platelets again could prevent the complications of sepsis. Thanks to your fundraising, we have found new potential biomarkers which we are sure you're just as excited about as us. We would love to hear your thoughts on going forward with this research. We believe further research is needed to look at increased numbers of patients, look at improving the loss of function in the neutrophils and raising the platelet numbers, as well as increasing DNase activity and the proteins which bind to actin. With your continued support and your feedback, we hope we can help patients and reduce the deaths caused by sepsis drastically. Thank you.